Hello, and welcome to another episode of Your Public Health Professional and You, a program of the Maryland Public Health Association. I am Lillian Agbeegbe, your friendly community health educator. I'm also co-chair of the Communications Committee, and we are the producers of Your Public Health Professional and You. We have been talking to public health professionals about their work. What do they do? And how does their work impact members of the public, some of whom they will never get to meet? Well, today promises to be another interesting episode because I'm talking to a public health professional, very diverse and very interesting background. And I bet you will agree with me once the interview is over. Alton Reid, welcome to Your Public Health Professional and You.
Thank you very much.
Great, Alton. I have your bio here and I can read it, but I always like to meet people by themselves. So tell us a little bit about you. Who is Alton Reid? An overview, a brief overview. We will get into the details of your work, but really just let's get to meet you first before we talk about your work.
No problem. So my name is Alton Reid. I'm with the EPA Office of Inspector Generals. I'm a health scientist at the Environmental Protection Agency's Office of Inspector General. I got my bachelor's degree from Virginia Commonwealth University. I don't want to age myself, so I'm not going to tell you what year it was, but it feels like a long time ago now. And I got my master's from Drexel University. And currently I'm in classes with my DRPH program in Rutgers University. But just a quick overview, that's who I am.
Great. Shout out to DRPH professionals. That's what I have at DRPH. Very excited to be talking to fellow DRPH in the house. So Alton, you talked about your bachelor's degrees, your master's in public health, your DRPH program, but the path to public health, how was that path for you? Did you always know when you were growing up that you wanted to be a public health practitioner? Did you know what public health was?
Okay, if I'm going to be honest, no, I had no idea I was going to be in this position. It's funny, I actually wanted to be a medical doctor at one point, but I think when I was doing different things, because I'm very exploratory, and I was just trying to do like different like activities while I was in college, and then for my master's, public health started becoming something more, I guess, physically viable to me. I kind of looked at the world a bit differently, especially when I was doing my master's thesis. And my master's thesis was on improving basically health through housing and home repairs. When I was doing that in my master's program at Drexel, I started seeing the importance of health policy, fundraising, grant writing, and just kind of soliciting grants to do public health work. And I think once I started seeing that impact, especially compared to like my childhood where, all I really understood as a kid was the government was good for getting us green cards because a lot of us, came from Jamaica over to America. That kind of experience made me say, hey, the government can do things and can help out people. You just kind of need the right people in the right places, if that makes sense.
So you said there's so many nuggets from what you said, having the right people at the right places, and the government can do things for the public. So let's look at the public health practitioner, because a lot of people don't really know what's public health. Some people think that, they don't work in the hospital, so what have they got to do with my health? But you said something about working in neighborhoods. And I know that you had that West Philadelphia neighborhood project that you did. So tell us a little bit about the home preservation initiative. How does a public health practitioner working on home improvement impact people that they might not get to meet?
So I actually worked on the ground when I was doing that project. I would go to people's homes. I would ask them questions after a home was repaired. And I would ask them mental health questions, physical health questions, and how they felt, generally speaking, after a home was repaired. Unfortunately, where I was in Philadelphia was considered a promise zone because promise zones were basically places that were picked by the government as sort of being low income and kind of needing help. Those areas within Philadelphia, they had those issues. So a lot of those houses, unfortunately, dilapidated or kind of, just wasn't the greatest built environment. As a public health practitioner, you might not be directly, taking people's blood pressure or doing things that you would think of within a hospital. But what you are doing is, for me, when I was doing it, you're kind of influencing policy and things that are happening at a more, I guess, I wouldn't say concentrated, but a bigger level, like maybe it either could be national or local base. And you're shifting perspective to people who do have the ability to give out funds or do work in that area. You're giving them healthcare data or information and other things that you're doing based off research that you've conducted, whether it be on the ground, whether it be through research, anything you're doing. You're giving that data out to people. And in a way, you're kind of lobbying to say, hey, based off this research that we've done within healthcare and the different facets of healthcare, this is important because it's giving this outcome. And in public health, you actually have to be kind of good at speaking to people and making people's stories kind of come to life. There's so many different ways to do that. And I think that's kind of the one thing that I like about public health a lot is you are essentially the mediator between the people who might not have a voice versus the people who might have the loudest voice. And that's kind of the big thing when I think about public health. It's you are the voice sometimes for the public when it comes to particular concerns. So it kind of requires balancing, if that makes sense.
So it does make sense. So you're kind of the voice for the people who don't have a voice, the mediator between the people who don't have a voice and the people who have the loudest voice. And talking about housing and policy, I used to work at the National Center for Healthy Housing. And, one of the things that we looked at in terms of looking at policies that can influence people is looking at healthy homes, addressing how homes can be safer so that people with asthma can live without having triggers, the asthma attack or lead-based poisoning in the homes. And can you give us some other examples of how, what sort of research have you done or has public health done that has resulted in a housing policy that has benefited people on a large scale?
So for the Home Preservation Initiative, we took inspiration from actually the city of Boston, where I believe they were doing things relevant to like essentially getting healthcare data and putting it out there to make sure policy was being influenced. What you do is you're looking at the built environment and some of the social and environmental factors and how it's impacting people. So when you're looking at housing, you're looking at the aspects of housing and how it impacts people because you're spending a lot of time in your house, right? You're cooking, you're sleeping, you're doing a lot of different things. When you're looking at housing, the aspects such as mold, such as mildew, disrepair, like there were things that I didn't even think about. For one person, I'm going to just give you an example. I remember she needed a handicap ramp for her daughter because fortunately her daughter had a wheelchair. She didn't have that before for her house. The Home Preservation Initiative came in and it built a handicap ramp for her. But because of the fact she had to kind of carry her daughter, she was actually getting back problems from that. And you don't think about those things that kind of connect things together. But when you become that person and become that voice to say, hey, we need to actually look at this, because if someone doesn't speak on this, you're never going to know that person's story. That's what kind of makes healthcare and public health important. You see the value of someone who could go in there, check what's going on, and make those ideas connect. And if you got, like I said, if you have the right people in the right places, they can end up being a great cogs to actually creating change. And that's what I saw with the Home Preservation Initiative. And we took a little bit of influence from Boston because they had a health program. And even there was one portion where, when I was doing something called data linkers, where I was essentially, trying to make sure the data that was shared between the different avenues or different players, I'll just say stakeholders within the Home Preservation Initiative, so it's just easier to share data. I took influence from how Boston was doing it, where, there were multiple people working within the program, data was being utilized, and how do you create a system where they could easily see this home has been repaired already, this home has stuff being done, this area needs more work, so you could be more efficient. That was something I did with the art program, I believe it was called, or design program. Anyway, it was a program that I did while I was at Drexel too, and I remember doing it after with the Home Preservation Initiative.
Awesome, awesome. And it's important that you talk about stakeholders, because that's really public health. When you're looking at
Yes.
social determinants of health, some of the buzzwords in public health, or buzz phrases is there's no need to reinvent the wheel, right?
Hmm.
And what we
Hmm.
can do together collectively, we do a lot of collaboration. How has your experience being as a public health practitioner collaborating across sectors?
That's a good question. Okay, before I answer that question, I'll say this. I'll probably talk about my job a bit. I don't represent the federal government. I don't represent the EPA or the EPOIG. But in my job, particularly, we do look at public health people in certain areas or certain jobs based on what we're researching. One thing that I did, and I think about it and how important it is, was it's a public report. It's about Border 2020. You could look at it online at EPA OIG reports if you want to. Uh, I remember during that job, we had to meet people from Mexico who were delegates, and they were talking about, concerns that were happening along the border wall, how it was impacting public health and just things of that nature. I remember when I was thinking about that job, and I had to think to myself, it's like, we within the government have to kind of make sure the voices of what these people are stating coming from a different country and making that make sense. And their complaints and things that they might be stating, how do you make that work together? Like, public health requires a lot of cooperation and collaboration, because you are one person at the end of the day, but you need to speak for many people. You can't do that all the time, because that just causes issues in the sense of you're stating statements that can't be representative of a group. But when you collaborate and you're pulling in different players and you're showing them that their voice matters and even bringing them to the stage sometimes, like, I remember at Drexel, during a data and analyst thing, or it was something relevant to, like, speaking to stakeholders. I believe we brought somebody from, what was it? I forgot the name of it, but we brought someone from, the people who were helping us while we were out in the field, and they were collecting data with me. I just can't remember their name right now. It's eluding me, unfortunately. Maybe that's age, but we brought them with us as a key stakeholder, a witness essentially. And while I was talking, or while anyone else was speaking, they could, verify what's going on in the neighborhood and the community, and talk about how, that grandmother feels a particular way and she's happy this got fixed. Or, my cousin got these repairs and thankfully they got something else better. Just having that group together and having people with you makes your voice be more representative. And it feels kind of good to just bring those people with you while you're talking to, let's say, the mayor or some official, and make a statement like, look, you see, I'm not the only one saying this. I'm trying to be objective. This person's saying the same thing. You're helping your community by helping these people. And I'm just here to just talk and make sure everyone's together.
So it's so much there, so many nuggets to pull out of that, but it's amplifying the voice of one person and speaking for the community, which is kind of a difference that we see when we're looking at medical health. Because when you go and see your medical provider is really talking about this person that is in front of them and what you're
Mhm.
facing. But
Mhm.
when you're engaging your public health professional who's looking at data, who's looking at research, who's collaborating with stakeholders over many fields, and then they're in a position to talk about things that are affecting more than one person or will affect more than one person.
Mhm.
I'm curious to hear what's your advice to some young person, or maybe not young person, but anybody who's out there who's like, I don't know about this public health. Is this a path that I should follow? What's your advice on somebody thinking of following the path of public health, and how should they go about it?
So my advice to people, if they really want to go within the public health route, is I think you should try to have varying experiences and be willing to understand things you might not have recognized at the time, or just be willing to have your preconceived notions kind of changed. Like, I remember when I presented APHA, the national aspect of it for the Home Preservation Initiative, they talked about gentrification a lot. Like when I was in the field, a lot of people talked about how, they're repairing homes, but we're worried about getting kicked out of our neighborhood or taxes increasing and things of that nature. When that came up, that didn't click with me because when I heard about that type of thing, it was more so like you're building something new, but not repairing homes and how that did things with values, like home values. Just hearing that and knowing that I was able to voice that at APHA or just a different type of group, that was something that I just didn't expect. And I was happy to hear it because I was like, I got to change my frame of thinking because I don't want these people feeling like they're getting the homes repaired, but their son or their daughter might not be able to inherit their home or whatever is going on with their parents. You have to be the type of person to not only want to understand people and what they're doing, but also be aware that not everything you think or what you're learning from class might actually be how people's real world examples are. I think having an open mind, having varying experiences, that could really lead you down the path of public health, especially if you want to be in the field and just be with people. Because sorry, I'm going on a ramble, but one thing with healthcare that I think it does sometimes is it focuses on the individual a lot, but public health is focusing on the population a lot of times. You can't just always fix that one person in front of you and expect greater things to just be impacting stuff. You have to sometimes look at it from I guess, the forest perspective and say, how do we make the forest not burn down instead of just looking at this individual tree that might have an issue going on?
Absolutely. You can't just fix that one person in front of you. So this one person in front of you goes to their primary care provider and they get their medication to feed them. But nutrition is a factor in their health outcome.
Mm-hmm.
And but you can't fix nutrition for that one person if you don't address the absence of a fresh food market in the
Yes.
community as a whole, or if you don't address the aspect of transportation for members of those community to go to the fresh food market to get fresh
Mm-hmm.
food. So you have to be thinking, yes, this one person is here, I can give them their medication, but really they're not eating well. And if that's because they can't get fresh fruits in their community, then we have to be talking to stakeholders across sectors to say, okay, fine, who's going to bring in those partners to start this fresh food market? How are we going to
Mm-hmm.
promote it? How are we going to let people know that this is beneficial for them? And
Mm-hmm.
bringing all of those partners and working together.
Mm-hmm.
Great. You also had a stint when you worked in the laboratory. I wonder, was that a public health thing? Because I'm just trying to explore the diversity of public health. People think that it's unidirectional and you can only do
Mm-hmm.
one thing, but public health professionals can do many things, right?
I agree with that. And that's funny. When I was at VCU, so that's funny story with that one. That is public health based because you are in a lab, and I was helping make a cancer drug relevant to like epigenetics. Epigenetics essentially things that are occurring outside the genome structure. Like it could be like a histone protein or just something going on. I don't want to ramble about it, but things that are outside your genetics itself that are influencing what's going on with your genes, like radiation, anything like that. So when I was doing that, I was in a class at VCU. This was when I was being really exploratory. I think I did a scuba diving class at VCU. I don't remember, but that was awesome. But I remember I did a class called the Biology of Cancer class. I had to get an internship in order to be in that class. I ended up meeting my mentor, he is still my mentor to this day to an extent, named Dr. Landry. When I worked at his, I believe it was molecular biology or genetics lab. When I was doing that, you are working in a lab every day. You might start doing Western blotting. You might just do a bunch of techniques that you're like, what's the point of this? But the stuff you learn in class, you realize the importance of that. And in the greater scheme of things, that little nugget of knowledge that you're adding in terms of a PhD's work or just something going on could lead to something bigger. Like, that was work to being done for like a cancer drug, and you don't know what the ramifications of that will be in the grand scheme of things. I wouldn't say it's completely public health based, but I will say when I started that, I started seeing the importance and the role of science because though it is important going to classes and stuff, I will say that when you're in a lab or you're doing the actual work, the things that you're seeing and the things that you're hearing, in terms of like enzymes and proteins and like what they do, it becomes something that goes from something that's theoretical to something that's, oh, that's why we do this, or that's why we do that technique, or that's why I have to stir this thing for like an hour with some buffer to make it like pop out on the screen. It it definitely became, I guess, an inspirational aspect of me doing that to say, you could do things with your hands in science, and it doesn't need to be something immediate in terms of what is created, but it will lead to bigger things if you just stay diligent.
So it made you think like, okay, there's something more here, or there's something more about this.
Definitely.
And as I'm thinking more, there's something more here, there's something more about this. I'm thinking about the Maryland Public Health Association. That's the association that's presenting this program. So I
Mhm.
wonder if you could share a little bit about your involvement with the Maryland Public Health Association and how that has benefited you, as if we can say so.
You know, it's funny. I just got in this program probably like 7 months ago. I'm actually in the policy committee. I don't actually go through policy related things until this year, but I have been to a couple events. I could say this. When I'm going to one of those events or I'm hearing things in Maryland or any of these places that I go to, APHA included, I'm hearing your perspective and I'm taking that perspective and putting it into what I'm doing. Like, not in every, I can't tell you the exact aspects how it is, but just hearing people on the ground and hearing what they're concerned about, that is inspiring research, like going to a conference. When I hear stuff going on in Maryland, I don't think about just Maryland being impacted. I think about the Chesapeake Bay, for example, and how the Chesapeake Bay might be impacting not only DC's waters, but it could be impacting Virginia's. And I try to think about it from the perspective of this guy's saying this statement for this particular issue, but what is it doing for everybody else in the region? Maryland Public Health Association is very good at that in the sense of like when you do events, you could hear those local issues. And to me, you could actually change your perspective or change your workload because I volunteered too. Like I volunteered with the Office of Community Relations here in PG County, but I could change like where I'm going or when I'm doing something and say, hey, maybe I could do this locally and make an impact here. Or this guy said this. Maybe there's like a farmer's market or some food volunteer bank that I could work at to just help out and just do things like that. And just a sidebar, that was actually the reason why when COVID was at its peak, I was a volunteer because, you know, I was researching things and going to random like events and I heard someone say that that was a possibility. So I ended up like volunteering, giving out COVID shots in PG County and, you know, helping people who were a little bit iffy about the vaccine, helping them get shots. It's like, it's all about the collaboration and connecting. I like hearing people's perspectives being like, hey, is there a way to help out? And that kind of moves me forward a lot of times.
When you're going out, you get the opportunity to hear what different people are working on, and it spurs your thinking, Will, to think not just about the situation they're reporting about, but on what else can be done within and around the community. Thank you very much. Ladies and gentlemen, I've been talking to Alton Reid. He's a public health professional working here in the state of Maryland and doing a lot of exciting things. He's currently doing his doctor in public health. I'm a practice, you know, as I say, but it's a DRPH and really honing in the skills and working in various fields in public health. Alton, is there something you'd like to tell us about just who the public health professional is and the work that you do that we haven't talked about yet?
Uh, I want people to understand that, you know, always try to be connected to the ground, no matter how high you get. I play basketball. I go to the neighborhood. I go to cookouts. I go to random things in the neighborhood and just hear people out. You never want to feel like you're too big to deal with people at any level or any capacity. If you kind of have that humbleness, it really does make a difference for your job. Just one last thing. At VCU, for example, when I went to APHA in 2022, I didn't expect this cascade in a way, but I didn't know what their public health program was. I had no idea that it even existed. When I came back from APHA, I kind of made it my mission to work with the recent graduate council and the alumni council and say, hey, can we work with VCU's public health program? Because I know public health is important. When I did that, they actually, you know, I work with the African American Alumni Council and some of my friends there. there are people now who are involved who are trying to make it an annual thing to take the public health program and work with the African American Council and kind of always try to promote it like Public Health Month sort of thing going on at VCU. Like, great. It's moving forward. I think they got like some type of official school of public health now at VCU. And even though it's like the small beginnings, if I had a mindset of like, oh, this isn't something to worry about, it's nothing big, I would have never said, hey, instead of me thinking like I am in a position I got to watch what I'm doing or just who I'm helping, it's like, no, I see that there's people here who need help. As a public health practitioner, how do we get the public to actually, do this and push healthcare in a positive capacity? Keep your ears to the ground. I think that's something I wish a lot of people did more.
Keep your ears to the ground. I think one of my main takeaways from talking to you is how, there are many sources for information, and information helps you to think and to really explore what else. So somebody says something, but you're thinking like, what else? What does this actually mean? And what else? What can we do with this information? And where can we go with this? And all of this is because we're really interested in Marylanders living a healthy life. But hey, if you listen to Alton, he said, when he would say something about Maryland and he's thinking, who else is connected to this? Who else can benefit from this? So when we say, the Maryland Public Health Association, our focus is on Marylanders, but even watching our program, listening to our conversation with our public health professionals, you can be thinking about, hey, what's going on in your area with public health? What can you do with public health? And how can you benefit members of your community living around you? My name is Lillian Agwegwe. I'm your friendly community health educator, your uncle for our program here, your public health professional, and you. Until I come your way again with another episode, I'll let Alton say goodbye, and then we'll see you some other time. Alton?
Thank you. Appreciate it. Appreciate Maryland Public Health Association for me having this interview. And thank you, Dr. Lillian, for allowing me to have this time with you. Appreciate it.
Thank you very much. If you want some more information, go on our website, www.mdpha.org. Get info at mdpha.org. Send us your emails, your questions, your contributions, and look forward to seeing you some other time. Thank you, and enjoy the rest of your morning, afternoon, evening, whatever time you're watching this video.